of all, I'm very thankful to Mr. Vivek and his team for inviting me here, because I feel very humble listening to all of the great talks and really knowledgeable for myself also. So I really going to share just my experience, because I do not feel I have something great to share. Already heard very great things here. So my journey started with a very simple vision, and that was nation building. When I was in US, I decided to come back to India with a very simple vision that it has to be us who has to build our own society. It is not going to be China or America. And the vision was very simple, to solve the basic problem of the society by doing the very groundwork and by building technological innovation. Basic problem means the problem which is bleeding the society, which is bleeding those 95 crore people which we never count in our business of healthcare. By doing the groundwork means we need to develop the technology by feeling the service provider who are working in these areas. We need to develop that technology to empower them. By technological innovation, certainly not jugaad, but something which can be scaled up. So with that vision we started. The biggest strength I had is I had a lot of patience. I was not in any hurry. In my peak career time, so-called, I worked for 4 months finding out a problem I would like to work with, where I can attach my whole life along with. So I visited many institutes, many areas. I find out the problem of diagnostic to 95 crore people of India. Heart attack, liver damage, kidney damage, diabetic, anemic, and most of the time, the tragedies, they do not even know what happened to their body. What was the reason it was not reaching to the people? It was not the reason that medical solution was not there. We always do liver function test, kidney function test, lipid profile, everything we do, but we are not able to deliver to those people living in the remote location. So the challenges were something else. What we find out, that technology which we were using till now, they were never designed and built according to the Indian conditions. And those challenges were, you will not find good roads to travel on where you can take this delicate equipment over there confidently and run the service over there. You will not find skilled manpower, you will not find electricity. If something goes bad over there, this is one of the biggest problems. If something goes bad over there, it will never be fixed. It will just go away. So we took that as a challenge. We developed our own technology. The present equipment, which is 7 to 8 kg heavy equipment and very delicate, even if you shake, it will go bad. We successfully developed 600 gram analyzer. We are the medical device company who do drop test. We drop from 2 feet height, the reading should not change. We make sure from 0 degrees centigrade to 50 degrees centigrade, the reading should not change, because currently I have installation in Leh Ladakh, Kargil and Jaisalmer area, extreme temperature conditions, and it works. The most important is, again, affordability. After developing unique technology, patent technology, we own 25 patents now. We still kept it open system. If I am using in Jaisalmer area in a village, if my consumable finishes up, he can go to local market, get the consumable over there and run the lab again. So what you see is this. We still ask ourselves, by building this innovation of analyzer, does it solve the problem? The answer was clearly no. Because in a blood test, we take the blood sample, centrifuge it, prepare the sample, incubate it and then read it. And we clearly saw that we need to miniaturize everything. And here is the innovation right in front of you, where we miniaturize the centrifuge, incubator and the analyzer right in the device, right in the suitcase, with a complete power backup underneath. So where we learn from that, we always learn from our user. We always out there seeing how they are using our innovation, where they are facing challenges in using it. For example, when we sold it to NRHM Haryana, we told them it is going to give you 4-hour backup. Very soon they come back, they said, "Isme to 15 minute ka bhi backup nahi aa raha." We clearly saw they are not charging it. If they will not charge it, they will not get the backup. But we didn't blame them. We went back, we further optimized our solution. What we did is, we made 3 connections in the back. Don't worry. So this is, one is AC, one is battery pack and one is solar panel. Now this lab works on a 80-watt solar panel without providing any electricity from the front. And even if sun is not there, there is a external battery pack on which it will work for 4 hours. And that battery pack I can charge through even a bike or a car. We do not leave even a single reason left out that the service will stop in those remote locations. What the recognition we get? Tremendous. We got the launch from President of India. I have currently more than 500 installation with Indian Army. In Nepal, tragedy, Sri Lankan Navy, Indian Army, all these organizations chooses our product, taking over there, providing the medical diagnostic from our solution to them. More than 100 NGOs, Vocard Foundation, DLF Foundation, AmeriCare, HelpAge India, a lot of organizations, they are using our innovation currently. A lot of individual doctors. But still, we asked ourselves, did we solve the problem? What we started with? The problem was taking this basic healthcare diagnostic to 95 crore people of India. Means major chunk population we are talking about. Even talking about government, state governments, lot of NGOs, I was not even reaching 0.1% population of the country. So we clearly saw that is not the answer. Institutional, certainly that's a great recognition, but ultimate medical service happens through the market. If I ask every one of you, most of us doesn't go to the government setup to get the service. Whatever the private clinic doctor is available in the society, that is my solution, medical solution over there. Is my solution moving that market? We try to run this kind of model. We started running health camp in a nano car. But very quickly find out it is still not viable. This nano car, 2 lakh rupees, 2.5 lakh rupees, the biggest challenge is the driver, 15,000 rupees a month. Right? Non-medical person, extra cost. Every month you have to pay. 5 rupee a kilometer. There is no way I am able to find out that much patients or the people I am going to give the service that it will become viable. So what I am going to do? What a small service provider is going to do? Shut it down. The same thing I did. That this is not going to work for my country. And now we are very clear that it has to come. It has to come on a bike. And we took that as a challenge. We actually made it. We made it very beautiful solution. Now comparison of the bike is, it is 70,000 rupees compared to 2.5 lakh. If I compare with government MMU, it is 10 to 12 lakh rupees. Bike is 70,000. 15,000 rupees a driver, no driver required. If he is standing up, it is not costing you anything. 5 rupee or 10 rupee a kilometer, it is 1 rupee per kilometer. Now very simple basic question to you. I come to your doorstep. I take only 2 or 3 minutes of yours because most of the people doesn't go for preventive care. The biggest reason is not even affordability, not even accessibility. They are certainly very big reasons. But the biggest reason is I am too busy. Even a laborer doesn't have time to go free camp because his whole wage will go away. So the real solution for preventive care, what we actually learned from the polio eradication also, polio eradication became only possible in India when we decided that we have to go to doorstep. We have to go door to door to give these polio drops. Then only it became possible. Same thing with preventive care. It's the people mindset which we need to work with. And we find out a solution to that also. That we are going to come at your doorstep and we are going to take only 2 or 3 minutes of your valuable time, because your valuable time is for the country. I am going to deliver this glucose, hemoglobin, lipid profile, liver function test, kidney function test only at 250 rupees. And this is not me who is going to deliver it. This is going to the village youth who is going to be skilled, who is going to be trained, and he is going to provide this service at this humble cost, and he is going to make profit out of it. So this 250 rupees involves depreciation cost, petrol cost, manpower cost, all cost of the raw material, everything in it. And we will make, if we get only 5 people for this screening in a day, the potential of the bike is 50 screening. If it has full potential, within a month, he will recover the whole cost of the LaBike. That is the viability we create, and would like I think I totally skipped the presentation. You can play the video now. Did I send you this one? After this. So when I talk about building technology, technology doesn't have to be rocket science. You will not imagine we have built such simple technology in our innovation, but they are so effective. When we are talking about analyzers, certainly that was a high-end technology what we developed that is not going to work even in 2 feet high drop. It is not going to change the reading from extreme temperature conditions. That is a lot of R&D we did. But when we were running camps, we were screening 800 people in a week time. What we saw, the most of the time this lab technician was spending was going in, washing these cuvettes. So what they were doing is, so generally what we do is, I take this blood sample in 2 ml oil, centrifuge it, then prepare the sample. I prepare 25 glucose sample in this, incubate it, and read it in the device. This device is going to take only 2 seconds to read one sample. But after that I have to wash it. So what the lab technician was doing is, he was throwing them out, washing one by one under the tap, putting them back again and sequencing them again. It was taking half an hour to prepare this 25 cuvette set. And that was a wastage of time. So what we did, we put up simple cap on this. Now you rinse it. None of the cuvette came out. Means your sequence 1 to 25 remain intact. You don't have to re-sequence it. Huge time save. After that, we made this washing system. Initially we thought we are going to make this piston based, that Pichkari based, but then we thought if rubber goes bad, he will throw it away. Healthcare worker is not going to fix it. So we made it a very simple, just water bottle. A distilled water bottle, you fix it, you squeeze it. There are 25 nozzles which will go into the cuvette box and will wash in one go. Now this is an innovation which you can see, it can never fail in a rural area. There is no motor, there is nothing like this which can fail. But it's so effective, the thing which was taking 30 minutes, now it is taking only a single minute. Where I was using 2 liter water, which is again a difficult resource to get in a remote area, I am using only 50 ml water to wash it. The cuvette I was using 20 times, now I am using 100 times. The cost has come down, better accuracy. But a very simple innovation. Then one of the again most revolutionary step I consider what we developed, because what we saw in a government settings, the small government hospital, the lab technician who is running these labs, he doesn't feel accountable to provide quality. He will not run quality control for months, for 2 months, because there was no quality control provided to them. And he doesn't feel accountable also, because it's extra work. So what was happening is, they were reporting wrong results, means having a laboratory infrastructure doing more damage rather than not having it. So what we did is, we developed the innovation in the box itself, that if doesn't put quality control for 3 days, it is going to give him warning. And for next 4 days, if he doesn't do it, it will get blocked. He need to call customer care, sir, please activate my device. It means he himself telling that I'm not doing my job well. This device itself is going to tell how many tests being performed for glucose, hemoglobin, creatine on a daily basis, the number. So if you are sitting in Jaipur and the device is installed in Jaisalmer village area, you exactly know how much it is in use. If you are using in a camp activity, you will clearly find out that where the exact location is. So all this satellite control feature we developed just for making sure that quality is delivered, investment is secured, and you exactly know how much this innovation is in use. Then we developed this Bluetooth and cloud computing, so it will be transferring to the laptop, which will sync to the server, so he can see all the reports from the server itself. So video है? Video नहीं है मेरे मोबाइल में. So doing all this, we developed this analyzer, but if you see the whole journey was driven by a single thing. Whole journey was driven by single problem, that 95 crore people of India, they are not getting quality diagnostic. from analyzer to mobile lab to a LaBike. I wish to share, make sure that whatever we develop for masses. So the unique thing, how we are proposing now to use this innovation as a preventive care is to empower the doctors, to empower the clinics. The same way the NGOs are using it. Right now there is a huge gap between a hospital and a healthy community. Healthy community doesn't want to come to a medical facility till the moment he becomes patient. He will never come. He will only come when he will become patient. So generally the smaller clinics available in the society, they are not being used up to their potential. Is there a way to bridge that gap between a healthy community and the medical facility? The answer is yes. We have found out ways to do it. And in that direction we have built the innovation. One is this portable BMI, what we developed and what is being developed by our R&D group, which is again Lashna Research Laboratory. So what this is, generally if you find that BMIs are big and bulky, you cannot move to the village area, you cannot screen them. This is a BMI which is completely portable and will be packed. Will be packed like this in a very, very small setup. So this will be the size. It will go little more deeper. But this same infrastructure now I can use to screen at least 100 of villages. And this is completely automatic. You just stand over there, it will measure your height automatically, it will measure your weight, it will tell you the BMI. So what we have observed, the doctors who has put up this right in front of their clinic or the hospital, they have put up right in front of their hospital, the general public who is passing by, they come on this BMI, spend a minute, so that spot become well known. And what I have seen, it is increasing their ROI. So this innovation is quite well working. And we are similarly coming out with these kind of innovations, which is making sure that we are able to empower present medical facility to make sure that the people in the society are able to utilize those services properly. So I think so if there are any questions, it's in WhatsApp video, which is causing problem while doing the test. We clearly know that we need a tent, but the challenge was that tent has to go on a bike. The challenge was the chair has to go on a bike. The challenge was BMI has to go on a bike. We did everything on the bike. Another challenge was we had is this LaBike model. We need to make sure that it remain very, very effective, that I can run a camp even going in a Dehradun.
Tuesday's latest technology, LaBike, is capable of providing diagnostics at the doorstep. So here technician has brought the LaBike in the premises where he'll set up the complete infrastructure. The total time taken to set up the LaBike is 5 minutes. The canopy is erected and technician would be able to conduct all the tests. You can see all the panels, the biochemistry, serology, hematology, bio-waste management, collection kits. So the patients are waiting out here where they'll go inside the LaBike infrastructure for their height, weight, BP, BMI and the blood tests. So you can see that the technician has all the equipments for a blood collection and also to perform the test. As soon as the test is over, the entire thing can be assembled in less than 5 minutes and everything can be packed and the technician is ready to go. That's how Doorstep brings in diagnostics at Doorstep.
We ran the camp through this from Gurgaon to Dehradun to Bilaspur in Himachal Pradesh, So the person simply took the bike over there and it cost him only 250 rupees of petrol reaching over there. So please. So we follow the same international protocol. We use Birat controls, which is followed by all international labs. I mean labs across the whole world. We follow the same protocol and we have made sure that even in the remotest location, that's what I talked about quality control, that we doesn't put quality control on it. It is going to switch off after 7 days. And those quality control values are reported directly on the web portal. I will log in, I will see this report in the Jaisalmer area, what are the today's quality control values over there. So I can control 100 of labs just by sitting, because my pathologists, they are very rare. I cannot have pathologists in every village. From single place, he can control 100 of labs, making sure every lab is maintaining the quality deserved to the people of India.